right.
Hello, everybody. I'm Dr. Melody Phillips. I'm a family medicine physician here at WVU Morgantown. I am also Morgantown faculty for the culinary and lifestyle medicine track that we have for our medical students here. I am certified in culinary and lifestyle medicine both, um, which is why I am here presenting to you today the new 2025 beverage guidelines for children and adolescents. Keep in mind this is for children and adolescents between the ages of 5 and 18. There's a separate set of guidelines for infants and a separate set of guidelines for toddlers, so this is specific to this age group. Although I have to say I looked at the guidelines and they're not very different in the toddler guidelines. Slide. So today we're trying to look at key shifts in the consensus guidelines to update clinical practice. We're trying to learn how to evaluate a patient's beverage intake using the guidelines to identify health risks and prioritize interventions. We're trying to learn how to justify our rationale to patients to avoid or limit specific beverages and develop counseling strategies that can help apply the 2025 guidelines to address common patient barriers. Next. So, the importance of what kids drink has really um, the importance of it has grown within the past several years, looking at not only what it does to children's mouths, which we've been looking at for a long time, but also looking at what it does to the rest of children's bodies. We are required to document our dietary counseling yearly, and beverage intake needs to be a part of that counseling. We know that dietary choices in childhood affect lifelong health, but oftentimes when we do our counseling, the focus is on food more so than it is on beverages, even though evidence is showing the critical role of beverage choices, and the amount of that evidence has grown. Next. So, why do we need new guidelines? Well, there were four groups that got together to determine these guidelines. There's a broader scope. There's also more specificity in regards to why we're choosing the beverages that we are. Um, there is a firmer stance on diet drinks because in the past that's been kind of up in the air. There are now clear hydration targets, so we know the minimal amounts of fluid that are needed in order to make sure that children and adolescents stay hydrated. And as I mentioned, these four groups got together to create a unified voice for these guidelines. So it's the American Academy of Pediatrics, the American Heart Association, the Academy of Nutrition and Dietetics, and then the Academy of Pediatric Dentistry. All four got together and collaborated on these guidelines, and so this is really a focus on overall health of children. Next. So I know this is a busy slide. This is kind of an overview of what the guidelines are. We'll dive into the specifics as we go through. But you can see we have green, yellow, and red. So green is what drinks are we encouraging children to drink? The yellow is what are we limiting or what has kind of some guidelines around it, some guardrails around it. And then what are we trying to avoid? And you can see that with taking into account the total hydration needs, like I mentioned before, there is a split between 5 to 8 years. So the childhood phase, 9 to 13, the preteen phase, and then 14 to 18 years, the teenage phase. There's different recommendations in each age group. Next. So, like I said, that was a busy slide. Let's take a pause here and think about why we need these guidelines and what we need to do to keep the kids healthy. And, what's going to be the number one drink that we recommend, and that's going to be water next. So, starting with our beverages to encourage next. So this slide contains both the total hydration needs and the water recommendations for each group, 5 to 8, 9 to 13, and 14 to 18. Um, and the amount of plain drinking water is the total hydration needs minus the recommended milk and juice targets. So that's where they get those, bottom and top numbers. So from 5 to 8 years, it's recommended that all children get at least 40 ounces of fluid per day, and at least 16 ounces of that should be water. From 9 to 13, it starts to break down between male and female because males are going to require a slightly higher amount than females are. So you can see that 61 fluid ounces in males versus 54 fluid ounces in females. Um, and then the breakdown there with males needing about 29 to 61 ounces and females needing about 22 to 54 ounces of water per day. And then in 14 to 18, you see it goes up even further, and the split is even bigger. You have 88 ounces in male teenagers, with at least 56 of that being water, and 61 fluid ounces in females, with at least 29 of that being water. So, next. Some notes on water. Obviously, water is the primary recommended beverage. It's inexpensive, it's calorie free, and it's widely available to people. I understand that there are times and places where there may not be as safe um, water availability, but for the vast majority of the country, potable tap water is what is recommended. So you can see that the recommendation is fluoridated, and that probably comes in from the pediatric dentistry group to try and maintain enamel in children's teeth. You want to make sure that it's plain water. Plain carbonated water is okay in limited amounts because the carbonation itself does not change the pH that much. It may drop it into the sixes from the neutral seven, but the flavors that are added into both carbonated and non-carbonated water can actually drop the pH further. That's where you get things like citric acid, malic acid that are being used to flavor these beverages. And that can lead to enamel erosion. So flavored water is not preferred. Plain water is preferred. Next. And then the other drink of choice is plain pasteurized milk. The reason being that it's going to provide a whole host of micronutrients, calcium, potassium, and then the vitamin D that gets fortified. And these are nutrients of public health concern. These are nutrients that are frequently decreased in our pediatric population, and milk is an easy way to get those nutrients in. Now, what kind of milk are we looking at? Typically, we want the more nutrient dense type of milk. So, the types of milk that are going to give us those nutrients of concern without the risk of weight gain or negative cardiovascular implications in the future. So, you typically, excuse me, typically going to see fat-free skim milk or 1% low-fat milk because that's going to help limit the calories and the saturated fat, which are nutrients of concern on the other side of the spectrum. For children that have lactose intolerance, and we'll get a little bit more into this as we go through, but using low lactose or lactose-free dairy alternatives are actually preferred over the plant-based alternatives. Now, this is different than somebody who has a frank allergy or other medical reasons not to drink milk. But if it's specifically a lactose intolerance, using the lactose-free or the low lactose milks like Lactaid are what's preferred. Next. So now we're getting into the yellow part of our stop sign, the beverages to limit. Next. So 100% juice is allowed, but in limited quantities. So whereas the numbers that I showed you before were minimum targets to hit, these 100% juice targets are the maximum targets to hit. So from 5 to 8 years, you want to have less than 4 to 6 ounces per day. From 9 to 13 years, less than 6 to 8, and from 14 to 18 years, less than 8 ounces per day. So you can see that even teenagers should be having no more than 1 cup of 100% juice per day. And why do I keep saying 100% juice? Because there are a lot of drinks out there that are juice beverages or fruit beverages that are not 100% juice. And those are not going to have anywhere near the nutrients that we see in juice. Now, that being said, even though there are some good nutrients in juice, it is lacking one of the other nutrients of concern, which is fiber. And the best place to get fiber is in real fruit. So if we're looking at how are our children getting their fruit in, we prefer whole fruits as opposed to fruit juice. But if we want to use a little bit of juice to help meet that requirement, we can up to half a cup to a cup a day. The liquid calories tend to be less satiating because of that lack of fiber. So when you're talking to your kiddos, try and get them to eat the orange rather than drink the orange juice. But if there are cost issues, availability issues, we're getting into the time of year where it's harder to find fresh fruit that is actually tasty and nutrient dense. So when that gets a little bit harder, then we can think about juice as an alternative. Next. So I told you I'd come back to the milk alternatives. Um, the guidelines do touch on plant-based milk alternatives, and it's not an automatic no because there are situations where plant-based milk alternatives need to be an option, such as medical issues, milk protein allergies, galactosemia, or people who have specific dietary requirements, such as veganism. So we need to be aware of what the guidelines say in regards to the plant-based milk alternatives. We need to find a plant-based alternative that tries to hit some of those nutrients of concern, very, very close to the levels that we see in dairy milk if we're replacing dairy milk with a plant-based alternative. Right now, the only ones that meet that criteria are unsweetened soy milk and then a handful of pea protein milks. So your other plant-based milk alternatives tend not to hit the micronutrient requirements that are recommended, and they're not going to meet the guidelines for federal child nutrition programs such as SNAP. Next. So, part of the thought process, as I mentioned, is that a lot of these plant-based milk alternatives are not going to meet the nutrient profiles that we typically see with dairy. So, they're not going to be a good one-to-one replacement to dairy. And a lot of these products have the nutrients fortified far more than dairy milk does. And it's really not known what the bioavailability of these fortified vitamins and minerals are compared to their naturally occurring counterparts in dairy. Um, if you do have a patient who is using a plant-based milk alternative for any reason, you want to make sure that they're getting a plant-based milk alternative that avoids added sugar, which if you look at the products, is not very easy. And it's also part of the reason that the unsweetened soy milk is recommended because that is one area where you can get an unsweetened plant-based alternative. Otherwise, it's very, very difficult to find those that avoid added sugar. Next. So sweetened flavored milk is in the limit category as opposed to the avoid category for a reason. It's still going to get you the nutrients that are available in milk, but we do have to watch the amount of added sugar. Now, the dietary guidelines for Americans recommend limiting sugar, and the American Heart Association recommends limiting it even further to only about 25 grams or 6 teaspoons of sugar per day. And if you look at a lot of sweetened milk, it can meet or even go past that threshold of 25 grams. So, got to be careful with the sweetened flavored milk. Now, one thing that we need to know is that schools are going to offer flavored milk most often. As of July 1st of this year, the USDA is starting to limit sugars in school milk, and so we should be seeing some lower sugar, sweetened flavored milks hitting the schools. But just know that choosing that at multiple meals, both breakfast and lunch, or both lunch and dinner, may exceed the daily limits of the sugars that we're going for. Next. So now we've gotten to the red part of our stoplight, which ones that we want to avoid next. So, number one off the bat, sugar sweetened beverages. This has not changed. Sugar sweetened beverages do not add anything nutrient wise, and they do add unnecessary calories that could lead to negative health outcomes such as obesity, as well as they frequently have a lot of additives that wear down the enamel. So, what included in sugar sweetened beverages? We've got sodas, sports drinks, fruit drinks that are not 100% juice. The new one that I'm seeing out there is the agua fresca. They market that as kind of a healthier beverage, and maybe it's a little bit lower sugar, but it's still a sugar sweetened beverage. And then, of course, sweetened teas and coffees. Now, there is a caveat here about sports drinks for your high school students that are doing, two-a-day practices in the heat. Um, it's allowed to have a sports drink in that situation, but most of our kids are not in that situation. So most of our kids should probably be avoiding the sports drinks unless they're exerting themselves for an extended period of time in extreme heat. Next. So, as I mentioned, sugar sweetened beverages are the largest source of added sugars in the diets of US children and adolescents, and linked pretty strongly to things like type 2 diabetes, obesity, dental caries. So, they provide these discretionary calories with little to no nutritional benefit. So, there's really no place for them in a healthy diet. Next line. Now, this is actually a change in the guidelines compared to previous. So, drinks with non-sugar sweeteners, so that's our aspartame, our stevia, our sucralose, are now considered beverages to avoid. It used to be thought, well, diet is better than full sugar, but the WHO recently came out against non-sugar sweeteners for weight control in children or adults, citing potential interference with gut bacteria for certain non-sugar sweeteners, and also the lack of data, long-term data, proving or disproving any sort of long-term outcomes. So, since childhood is a critical period of growth and development, we want to try and avoid things that are unnecessary or understudied as much as possible until we know a little bit better what sort of outcomes we're going to see in the long term. So that's where non-sugar sweeteners come into play now, as well as our next slide, which is caffeinated beverages. This is also a departure from the previous guidelines. Previously, the AAP allowed for up to 100 milligrams of caffeine per day, but we honestly don't know what caffeine does to growing bodies. Um, a lot of the caffeinated drinks, especially the energy drinks, can contain extremely high amounts of caffeine and, of course, other stimulants as well. And they're not always required to disclose the amounts. So we don't know how much caffeine our kids are actually getting when they're drinking some of these. And we know that caffeine can negatively impact sleep, mental health, and can throw off dietary patterns in adolescents, especially if they're driven to expect that sweet tooth. And because we don't know what an actual safe level of caffeine is in our children, including our adolescents, um, there's no way to really give specific guidelines or guidance on an appropriate amount of caffeine. I'm sure we'll get a lot of pushback on this, but this is what is recommended with the updated guidelines. Next. So, going to go through a few things that we can practically do with our patients next. So we want to try and frame it positively. I mentioned some departures from previous guidelines that are going to be really touchy for a lot of people. So let's frame it as positively as we can and focus on what we can do more of, which of course, number one thing we can do more of is water. Number one thing that most of us out in and out of childhood can do is water. And of course, as always, we want to take our patient-centered approach. So We want to provide appropriate guidance for our families that choose plant-based alternatives, either for medical, cultural, or ethical reasons, and help them find products that are as nutritionally similar to cow's milk as we can. Of course, focusing on the three nutrients that I mentioned, which are the calcium, the protein, and the vitamin D. We do need to be aware that dairy might not be a staple in all cultural diets, and we need to be able to be flexible in this regard. Um, of course, we also need to keep in mind budgetary concerns. There's a reason that a lot of people buy soda, and that's because it's cheap. Um, again, trying to push tap water as much as we can, having cups or the reusable water bottles, that's going to be the most economical and most environmentally friendly option. Next. So we're keeping in mind that these recommendations are not just for individual counseling, although that's where it's going to come up the most with us, but it also highlights the need for broader change. So I mentioned that the USDA is already trying to put in the sweetened flavored milks in schools. Um, there are also a lot of schools that are trying to pull out their vending machines and minimize or get rid of sugar sweetened beverages, knowing the impact that they have. So, knowing what the school environment is like can be helpful, and working within our communities to help make the healthy choice the correct choices, or the easy choice is always going to be helpful. Um, like I mentioned on the last slide, encouraging use of reusable containers. Our glasses, our reusable water bottles over single-use bottles is going to be helpful for an environmental impact. And sticking with water is also going to be a more environmentally impactful choice because of the single-serve containers or even multi-use containers that come with milk, 100% juice, sugar-sweetened beverages, non-sugar sweetened beverages, and the like. So, as I said, the goal is to create environments where the healthy choice is the easy choice for all children. Next. All right, so some key takeaways. Water is the winner. Try and push water as much as we can. Milk is for nutrients, and so we want to try and hit those nutrients as closely as possible, either with milk or with alternative dairy products. So that could be yogurt, that could be cheeses, sticking with the unsweetened yogurts, of course, as much as possible. But trying to get that dairy in is going to be helpful to hit those nutrients that are so rich in dairy. And then making sure that we frame 100% juice as a treat instead of a daily staple. Next. All right, avoid the three S's, our sugar sweetened beverages, our sweeteners, and our stimulants. And then keeping in mind that the new guidelines are reflecting a more precautionary approach, which is why we're trying to minimize and avoid caffeine and non-sugar sweeteners to help prioritize the safety of our growing children. Next. All right, so this is where I'm going to pause for questions before we move on to our kids.